All right, good morning. It is 10 o'clock. We'll call this meeting to order. Welcome to the Grey Bruce Board of Health meeting for Friday, June the 24th, 2022. Mary, let's start with the roll call.
Sue Patterson.
Present.
Alan Barfoot.
Present.
Brian Milne.
Yep, here.
Ryan O'Leary will be joining later. Chris Peabody sends his regrets. Luke Charbonneau.
Here.
Selwyn Hicks.
Here.
Helen Claire Tingling.
Morning, everyone.
Janice Jackson sends her regrets. Nick Saunders. Nick Saunders.
Okay, thank you. We do have a quorum, so we'll continue. I'll ask if there's any amendments to the agenda. Seeing none, I will ask for a motion to approve the agenda as presented. I need a mover and seconder. So anyone online may just raise their hand and I'll choose. So we do have a few people online and some members in person today. So I'll take Brian Millen to move it and Helen Claire to second. All in favor? That is carried. And everyone can hear me, right? Good, thank you.
Wow, that's ironic.
This is of interest to me. We're looking at public health inspector training, qualifications, roles, and responsibilities. So public health inspectors are environmental public health professionals who have specific skills obtained through specialized education, training, and national certification in Canada. Public health inspector roles impact every aspect of our lives, from air to water to food to employment and recreation to our homes and families. The Canadian Institute of Public Health Inspectors advances the profession, science, and field of environmental public health through certification, advocacy, education, and professional competencies. Public health inspectors must obtain a bachelor's degree from one of 6 schools approved by the Board of Certification. They must complete a practicum from an approved practicum training agency, such as the Grey Bruce Health Unit, and complete the certification exam, which consists of 2 formal written reports and oral board examination. Public health inspectors are responsible for 3 of the 9 Ontario's public health standards, including food safety, safe water, and healthy environments, and parts of infectious and communicable diseases, prevention, and control. There are numerous guidelines and protocols for each program. Public health inspectors, as provincial offenses officers, have numerous responsibilities, including compliance and enforcement of acts and regulations, including the Health Protection and Promotion Act. Public health inspectors, they have responsibilities for inspection of facilities such as food premises, child care facilities, small drinking water systems, recreational water facilities, personal service settings, international agricultural worker housing, recreational camps, arenas, and certain group homes. Quite a bit of responsibility there. They're also responsible for investigation and management of infectious diseases, sporadic and outbreaks. They respond to adverse events related to safe water, such as adverse drinking water. They provide feedback and approvals for housing developments, cemetery plans, business applications, liquor licenses, and special events. They provide local leadership and knowledge relating to climate change, adaptation, and mitigation. They assist with prevention and management of zoonotic diseases. I had to look that up. Zoonotic diseases are caused by germs that spread between animals and people, such as the avian influenza. PHIs are responsible for the rabies prevention and control program, including animal surveillance and contingency planning, and management of potential rabies exposures. They're also responsible for providing education to the public on private wells, food safety, indoor air quality, rabies prevention, and vector-borne disease prevention. Vector-borne, which is infection transmitted by mosquitoes, ticks, sandflies, and black flies. And I'll leave it at that. And if anyone has any questions, we'll take them. And I have a couple. I'd like to ask Dr. Era, how many PHIs do we have here at the Gravery's Health Unit?
Thank you, Madam Chair. We have a total of 16 PHIs. 4 of them are in the infectious disease program and 12 are in the general program. We have 2 managers who have public health inspector background. One of them is environmental program, the general program. The other one is the infectious disease program lead or manager.
Very good. So my second question is, they're responsible for cemetery plans. Can you expand on that a bit, please?
Certainly. So public health and specifically public health inspectors play 2 roles related to cemeteries. One of them is approval of cemetery plans, and there isn't consistent process for cemetery approval just because we get the requests from engineers or from municipalities, from planners, sometimes for advice. And in general, it is approve a new site or expansion of an old site to ensure that the cemetery itself is not going to affect health in the area or the environment in the area, whether it's at the water table or other component or other aspects. That's one aspect of the work we do there. The second one, anytime there is excavation of a graveyard or a cemetery, there must be by law a public health inspector present, and usually from the ID team. And that's mainly regulated under the Cemeteries Act.
Thank you. That's very interesting. Any questions or comments about public health inspectors? Brian Miller.
Thank you. Just a remark that Dr. Era made there just a minute ago. Did I understand correctly that any excavation in a graveyard requires a public health inspector to be present? So in the event of opening a grave, is that what I understood there?
Correct. One example doesn't happen quite often. 2018, I believe, one of the cemeteries buried a person in a spot, but that was not their family spot, so they had to move it to move the body back to where the family, the rest of the family or the previous family was.
I see. I misunderstood. I understand now. You're talking about a grave that already has a burial in it, not a new grave.
Correct.
Thank you. Sorry, I misunderstood. Thank you.
Okay, any other comments or questions? Helen Claire.
Thank you, Madam Chair. Through you, just wondering about the number of PHIs we are with regard to the requirement, the complement required. So how do we have a full complement of PHIs in this region? Thank you.
Through you, Madam Chair, the number of PHIs we have, the professional PHIs, plus I should mention, sometimes we have students during the summer who's doing practicum, as the educational note that mentioned, has been sufficient to meet our indicators and to meet our targets. In general, we have no issue with the number of people we have. This number is fluid and sometimes changes based on what's going to be coming down the road of programs that are mandated or certain projects that we are focusing on or strategic plan. But in general, this number is sufficient at this point.
Okay, Helen Claire? Okay, good. Selwyn, you have a comment?
Thank you, Madam Chair. I know that just about every place seems to be talking about challenges with recruitment. Do we have any challenges with recruitment of public health inspectors?
Through you, Madam Chair, it's never been easy to recruit in general, but throughout the pandemic, we have been able to up our number of public health inspectors and staff in general to meet the demand, and we remain an attractive organization for people to join. More practically and long term, we have been training public health inspector students through practicum, and that is a very practical tool to actually know the individual very well, and they would know our organization, and a number of them came back to have a career here.
Okay. I think it sounds okay, good. All right, we'll move on the agenda. So item 6 is adoption of the minutes, and we have the Board of Health meeting minutes from May 27th. Is there any discussion with those minutes?
I'm sure just a question on the length of county appointments. I just wondered if it had been brought up to Bruce County Council and Grey County Council, whether a decision had been made yet, whether it was going to be 2-year terms or.
The letters have gone out, Dr. Aaron?
Yes, Madam Chair, the letter has gone out to the 2 counties, and as the board acknowledged, it is a county decision at the end of the day. It's worth adding there or reminding people who are listening to us, one of the 2 counties, Bruce County, are in the process of looking at their bylaws, and they requested from us suggestion or recommendation, and we sent the letter. Along with the letter, we added the list of responsibilities and skills and work demand or hours demand that the position would carry with it to ensure that people would know what the committee is about and ensure we recruit the best fit for the board.
Okay, so that's just the update. Any other discussion with those minutes? Okay, I need a mover and seconder. Alan and Luke, all in favor? That is carried, thank you. Item 7 is correspondence and news releases. The first one, 7.1, is the 2 items for correspondence. Dr. Aaron.
Thank you, Madam Chair. We have 2 items. The first one is motion or a letter from the Toronto Board of Health outlining the support from the board to the medical officer of health to implement measures as they see fit in addressing COVID going forward if the provincial measures lifting or the process of lifting restrictions from the province was not sufficient for Toronto to address the recovery of the pandemic or future surges. And the recommendation is to receive. The second one is a letter from Sudbury District Public Health to the Ministry of Children, Community and Social Services regarding the Healthy Baby, Healthy Children funding. And the letter and the board from Sudbury strongly asked the ministry to reevaluate the funding and the increased need and the importance of this program. And for this item, the recommendation is to endorse, Madam Chair.
Thank you. Any questions about the correspondence? All right, I don't see any, thank you. We'll go on with the media releases. Welcome, Denis.
Hello, and thank you, Madam Chair, and through you. There are 4 news releases on today's agenda. 2 relate to dog bites and contain a description of the incident in an effort to locate the dog's owners, confirming the health of the dog can prevent the victim from having to receive the post-exposure rabies treatment. One of the news releases relates to World No Tobacco Day, which took place May 31st. And this news release includes information on the health and environmental toll of smoking. And the final release relates to an overdose alert, which was prompted by several overdose reports within a 48-hour period. Fentanyl was the suspected or probable opioid responsible for the overdoses, which were all non-fatal. And of note, naloxone, a fast-acting drug used to temporarily reverse the effects of an opioid overdose, was administered in each of the overdoses. And that is news releases.
Thanks, Denise. I have a question, Dr. Era. The opioid alert, was that across Grand Bruce or just specific to one area?
When we send these, through you, Madam Chair, when we send these alerts, we send it to the working group for vehicles for the entire area, but sometimes it's specific in a certain city if the police identify a certain substance or specific event.
Okay, so everyone is aware that it's happening across Great and Bruce. Good. Any other comments or questions about the news releases? I don't see any. Okay, so I need a mover and seconder to approve, to receive the first item in correspondence and the media releases. So I have Brian Millen and I'll take Selwyn, thank you. All in favor? That is carried, thank you. So now we need a mover and seconder to endorse the correspondence from Sudbury and District's Public Health regarding healthy babies. Alan moves it and I need a seconder. Luke, thank you. All in favor? That is carried. All right, so moving on, 8.0 is the BDO presentation, and we should have Tracy Smith online to present the BDO presentation. And she's not online yet. Is she in the waiting room? There she is. All right. So it'll just take a second. So Tracy, if you can hear me, the floor is yours.
Hello.
Hi, Tracy.
I am so sorry. I'm not sure what was going on with my computer today, but it didn't want to let me into the meeting. So I apologize, I'm late.
No problems. You're here now. So please go ahead.
Okay. So I'd like to thank the board for having me here this morning. I've been asked to give a high-level overview of the financial statements. I'd like to thank Kim and her finance team for their assistance in completing the audit. They always have working papers very well prepared and to assist us with the audit. So I'd like to thank Kim and her team. The report in your package is, do we want to put that on the screen or do you want me just to talk about it?
How does everybody feel? Do you want the?
Everybody's got it.
We
Okay.
all have a, yeah, we all have a copy, Tracy.
Okay. So I'll just quickly go through the package. So in your package, you should have a white report that is the required communication to the board. So just a high level overview of that report. The first part is our communication. As auditors, we have the responsibility to communicate with those charged with governance, which is you, the board, on an annual basis. So the report contains all that required communication under the auditing standards, and it is very similar to the prior year as the content is prescribed by those accounting standards. The executive summary on page 3, the financial statements are in draft. They do need approval by the board before we can release them in final. We do have to confirm with you that we are independent to give an audit opinion. Materiality was $450,000. There were no internal control issues or other issues that needed to be brought to the attention of the board. The unadjusted differences on page 7 of your report are not materials, so we can issue a clean audit opinion that the financial statements are not materially misstated. And then our audit opinion is in the appendix A on page 2 of the financial statements. So just a brief overview of those draft financial statements that we're asking you to approve. Our management has prepared these financial statements, and it's our responsibility as your auditor to give an opinion on those financial statements prepared by management. Our opinion is in the second paragraph. It is an audit opinion, so it's highest level of assurance that we can provide as a public accountant. And in our opinion, the financial statements present fairly in all material respects the financial position of the health unit in accordance with Canadian public sector accounting standards. That therefore it's a clean opinion, and we had no issues or concerns that came to our attention. On page 4 of the financial statements that are in Appendix A is the statement of financial position, or your balance sheet. It is a point in time, so that it is as of December 31st, 2021, which is the year end for the health unit. Total assets at that time were 5.9 million, and that was mostly in cash. The cash does fluctuate depending on when your subsidies are received. The cash position was 5.4, which is higher, quite a bit higher than 2020. And again, that's because of the timing of the subsidies. There was over $1 million that was due back to the province at December 31st, which you'll see down in the liabilities section. So in 2020, your COVID subsidies, they didn't come to you until after the year end. So you had spent all the money before you got the subsidy. And then in 2021, it worked the other way. You had actually received the COVID funds in advance, and some of those had to be repaid for 2021. The liabilities were 14.3 million. The largest portion of that is your long-term debt. Long-term debt at the end of December was 9.2 million. You did repay 600,000 of your principal on the debt during 2021. The other major difference in your liabilities is you'll see a larger amount for deferred revenue of 749,000. So the deferred revenue is the programs where you've received funding, but you haven't spent it, and you were allowed to spend that up until March of 2022. Which is different from the liability that you see as due to province of over $1 million. And that's for the programs where you've received the funding, but you hadn't spent all of the money and have to repay it. So there is a difference between those two types of funding. Your net financial debt, $8.4 million, represents the borrowing to build the building. And so again, that reduces every year as you pay off the principal. So you paid 600,000. So your net debt position has gone down. Your tangible capital assets are at cost less your amortization. So that's mostly the building. The accumulated surplus, essentially the capital reserve of 1,855,000, less unfunded post-employment benefits and vacation pay. So you do have a small capital reserve that increases every year from your MOE rent, less any capital that's not funded by subsidies. On page 5 is the statement of operations, your transactions for the year. So that's all the programs all consolidated together. The total revenues were 19.7 million. Again, a fairly large increase from the prior year. And that's due to the COVID funding, especially for the vaccine program, which again, as you are probably very well aware, started in 2021. So your funding in 2020 for COVID expenses was $719,000, and in 2021 that jumped to 3.6 million. So you can see the large difference is largely a result of that. Your cost shared programs funding level was the same as the prior year, just over $9 million. And then $3 million for other fully funded programs. The county contributions, they did remain the same as in prior years. Your total expenses were 19.9 million. So that includes $1 million amortization, which is not a cash amount, that's not funded. But it is required under public sector accounting standards to be reported in your financial statements. So when we remove that amortization, your expenses were almost $19 million. That brings us down to an annual surplus or deficit. So this year you're showing a deficit position of $120,000. So just want to make sure I know that that's not a deficit that's not funded by the province or county. It's not a cash deficit that you now have to fund yourselves. The funding revenue that you record in your financial statements does match the actual expenses that you have incurred during the year, and any differences reported on the balance sheet in that due to and from. So this annual deficit, it includes non-cash expenses of amortization. And so then if we take this deficit of 120,000, and then on the next page in the statement of changes in net debt, we adjust for those amortization and capital purchases, and that brings you back down to your decrease in net debt of just over 600,000, which is essentially the principal that you have paid down, which you have to fund, but it's not an actual expense on your income statement according to your accounting standards. So your ministry funding does not allow you to create a reserve, but you do have a small capital reserve of 1.8 million that is created out of the rental funds that you receive from MTO. And so then that concludes a very high level overview of the financial statements. If there's any questions, I'd be happy to take any questions.
Thank you, Tracy, and welcome to Janice, who has joined us. So I'll open it up. Are there any questions for Tracy? I don't see any, so that looks good. So thanks, Tracy, to you and your staff, and to our staff also. Was it an easier audit this year? Was it more in person or not?
We did a bit of a hybrid approach. So it does get a little easier, although with all the extra funding, it did take a little bit of time to sort through all that, although Kim does really good working papers, so we do appreciate that.
Good. Okay, I'll ask for a motion to approve the 2021 audited financial statements as of December 31st, 2021. Moved by Alan, seconded by Brian Millen. All in favor? That is carried. Thanks again, Tracy.
Thanks for having me.
Okay, next on the agenda, item 9 is corporate services. We have 9.1, and this is the financial report for April. Kim. Welcome, Kim.
Thank you. Madam Chair, this is the April financial update. So as of April 30th, we had a cumulative surplus of just over $204,000. This factors in the 1% increase in funding that was received, in addition to the seniors dental base funding increase. The April surplus is all from the seniors dental program and other small non-Ministry of Health programs. Our Ministry of Health program, mandatory programs, in addition to the COVID-19 and COVID vaccine programs, all continue to be fully funded at the end of April. One of the questions at the last Board of Health meeting was whether we had actually received any of the funding that had been approved. At that time, we had not, but I can confirm that since that last meeting, we have started to receive some of that funding from the ministry that was approved in our package. Our revenues continue to be under budget as we've required less COVID funding than what we forecasted. And this ties into the under budget wages and benefits, as well as the overtime hour graph at the end of the report, which shows the continuous decline in overtime hours to a very minimal amount. Our operating expenses continue to be under budget. And again, our COVID expenses have continued to be less than what we budgeted. For the capital fund, as of April 30th, we have not been required to complete any major building repairs. And for the capital projects, the Owen Sound Dental Clinic renovation was still underway at the end of April. There were some countertops and cabinets that we were waiting to be completed from the contractor, but we were able to reopen the clinic and see patients while we were waiting on those final pieces to arrive. Thank you. Are there any questions?
Okay, any questions for Kim? Well, I have one, Kim. In your report, you said plans are underway to utilize the additional funding. Is that for dental?
For you, Madam Chair, yes.
Yes, okay, good. All right, so I need a mover and seconder to accept the financial report for April 2022. Moved by Luke, seconded by, I'm gonna take Selwyn. Okay, no, sorry, I got Janice. Moved by Luke, seconded by Janice, all in favor. Thank you. All right, item 10 is the Medical Officer of Health update, and we'll start with Dr. Era.
Thank you, Madam Chair. We can put the slides now.
Thanks, Kim.
Okay, first slide, please. Thank you. Brief update, couple of slides on the COVID situation and the human monkey pox virus to keep the board updated there. So the first slide is about COVID, and the situation remains very stable as predicted. The number of new cases on average per day is less than 5, quite manageable. Number of hospitalization and ICU is minimal. 0 active outbreaks as of yesterday. I'm not sure if there was one today or suspect. Last new death was June 12th. And the staff well-being is considered and as the quote shows, there probably describes it very well. They have some room to breathe and predictable dates, predictable workload, and more areas to attend to in infectious disease than COVID only, which is reassuring. If we go to the next slide, just wanted to put this, and I hope we're not going to be perceived as immodest, but you know, good indication of the future is looking at the past. This is a death per 100,000, comparison between 4 health units in Ontario. One of them is Grey Bruce. I took the identifiers out. The tool where the data comes from is from Public Health Ontario, and there is a link there. It's a very useful tool, and you can look at trends and compare to predict Grey Bruce is in the yellow. The other three, one of them is one of the bigger centers where obviously there is more circulation and more were hit harder, or they were a hotspot for a long time. The other two, one of them is one of our neighboring health units. The third one is a very close comparator to Grey Bruce in the demography and geography, not close to our health unit, but in different parts of the province. It's just easier to compare with different parameters. And you can see throughout the death in Grey Bruce has been less. The trend is very similar. The first year we had 0 deaths in Grey Bruce, something that the board and everybody in Grey Bruce can be very, very proud of. We invested, all of us, into this. Then we saw in 2021 a number of deaths. Then there was July, right in the middle of the graph there. You can see where the Delta variant turned Grey Bruce into a hotspot. We were the second health unit in Ontario to deal with the Delta variant. We were a hotspot for less than 4 weeks. Then again, it was leveled off. It's worth mentioning this is a cumulative death, so the graph is not going to go down, it's always going to go up, but the steepness of going up is the indication of the frequency of the rate of fatality. Then obviously the Omicron is not controllable, and the strategy was there to mitigate, not to contain. And the trend is the same in the province, across the province. Nevertheless, the magnitude has always been less in Grey Bruce. And as I mentioned, presenting this slide, this is one of the variables or one of the factors that I mentioned last time to the board, that it gives me confidence that down the road, if there is a surge or a different variant, we are well prepared to deal with those changes. If we can go to the next slide, it is the update about the human monkeypox virus. Since our last meeting, those are the major changes that took place. As of June 22nd, there are 210 cases. So there is almost doubling every 2 weeks or so. Anecdotally here, those numbers are too small to with confidence say it's doubling around that time. The bulk of these cases are in Quebec, 171. In Ontario, there has been 33 cases, mostly in Toronto. There are a number of health units that has 1 or 2 cases. On June 16th, amendments to the HAPA Act, the Health Protection and Promotion Act, took place, and the disease became designated as communicable disease and virulent disease. And communicable means it's reportable, virulent means we have more teeth in the regulation to actually deal with it. Just for reference, TB, tuberculosis, is both communicable and virulent. HIV is communicable but not virulent. It's not as severe to cause death or to cause severity. So again, the designation shows the seriousness of it. And with this amendment, it becomes mandatory for every healthcare provider, for every lab to report to the health unit directly. And this would make the use of the previous order from the chief MOH null. That order served very well until gave us a window of time to make these regulations where it's reportable. The other couple of changes, sorry, if you can stay on the same slide, please, thank you. NACI provided its interim guidance for use of the vaccine, and that has been consistent with the interim local regulations or direction from the province in Ontario. Mainly, it's the use of the vaccine is post-exposure, after exposure. Mainly, there is some use before exposure to high-risk profession or high-risk individuals or groups that are identified. So that's the general gist of it. Provincial testing, I believe it's imminent, could be yesterday or today to start PCR testing in Public Health Ontario labs, so we don't have to send the sample to Manitoba, which was the first step in COVID and in this disease, and that's norm usually. There's a level 4 lab in Manitoba nationally that supports novel disease testing, and now we move to probably more quicker results being in Ontario. We have a bit more knowledge about transmission from the health units that have had no cases. Grey Bruce has not had any yet. One of anecdotal experiences, one of the health units mentioned that even household members were not infected. So the infection rate for household members is around 20%. Of every 10 household members, only 2 will be infected, and usually that's related to quite the interaction, whether it's sexual interaction using the same bed or so. So having a household member with the disease does not seem to be high risk of transmission comparing to the precautionary principle that we follow usually. And with more knowledge coming forward, I trust we will have more ability to manage those cases. Any question, Madam Chair? That's my update on the 2 diseases.
Thank you very much, Dr. Era. And I see Brian O'Leary has joined us. Welcome, Brian.
Good morning. Sorry I'm late.
Thank you for joining us. All right, any questions for Dr. Era? And please speak up. So I'm not seeing any. All right, so we'll move on. 10.2 is modernization update. There is no update at this point, so we'll move on to 10.3, which is the opioid situation in Grey Bruce. Dr. Zayed.
Thank you, Madam Chair. So the update for the opioid is really related to several points this time. First, there was the alpha resolution approved from the working group with some amendments, very minor amendments about the emergency declaration or considering emergency crisis. But the good thing is, again, the approval of this amendment and the resolution, which also have the 9 priority for public health. The other thing is the opioid working group, and so I will talk about the provincial and then we'll talk locally. So there are more roles and responsibility highlight for the Ministry of Health involvement, which we involve them in the working group with also key contact person in the ministry. So that's a very important thing to have this involvement. The other thing is there is a partnership so through the working group with Public Health Ontario, in which there is this partnership is related to evidence-based work and especially evaluation. And the partnership include a public health unit and leadership with the Public Health Ontario. We expressed here an interest, so 99% we will be the lead health unit with the Public Health Ontario on this project. And this will be a very good opportunity for the local community. The other great partnership also will be the CONCAP committee, and this is a partnership with Public Health Agency of Canada and Health Canada, and this includes capacity building at the local community. So community capacity building, and this includes also working with the University of Toronto to provide expertise at the local level in a community-based evaluation. And this is very important for the local work that we are doing right now, to have community-based evaluation and building capacity around evaluation of the local community work, in addition to working, identifying support team, including stigma and equity, evidence practice, implementation and operational factor, partnership and engagement, data and information. So this is really will leverage the community, the local work that we are doing. And so also the mental health task force, we have been working and discussing all these projects, and definitely we need this leverage and expertise. So the CONCAP work will be really good. And one specific thing, I have to go back to this partnership with Public Health Ontario, is to include the users and leverage this experience and communication of the users and the people who use drugs and their surroundings. So this will be really a great opportunity. And the other thing is related to the local work. So local work is, we have, the public health has a really definite role in that, in terms of planning, evaluation, equity assessment, and involving partners, including the people who use drugs. So evaluation of their experience. So this work has been really working very well, and we have this consistency of funding, and hopefully with some working with centers of excellence, it will give us more leverage. Thank you.
Very good. Sounds like things are moving forward positively and should be a benefit to great groups.
Yeah, and next time maybe I will give a presentation on the whole.
Yes, yes. Any questions or comments for Dr. Zayed? Helen Claire.
Yes, through you, Madam Chair. I'm sorry, I didn't hear the last comment that Dr. Zayed meant. Her mic went quiet.
I said next time I will provide a presentation to the board on all the projects, either provincially and locally, and how we are going to have this kind of projects, like a plan, our plan moving forward.
Thank you. Thanks, Madam Chair.
Any other comments or questions? Okay, I don't see any. Very good. That sounds like things are happening. So, all right, we need a motion to receive the medical officers of health update. I need a mover and a seconder. Selwyn moves it and Brian O'Leary seconds. All in favor? That is carried. Thank you. Item 11, we have an in-camera meeting. So it has been recommended that the Board of Health meet in closed session for the purpose of educating or training the members. I need a mover, Alan, and a seconder, Brian Millen, to go. Okay, we are now in open session, and I declare we discussed only the items on the closed meeting agenda. The May 27th in-camera meeting minutes were approved. Information was received for the purpose of educating or training members arose from this item. So we do, I'm going to call this under other business. Dr. Zayed has some information, exciting news she wants to share.
Thank you, Madam Chair. Through you, I just want to share that I just received the email that we are the selected public health unit who will co-lead the work provincially with Public Health Ontario. So that's really a great news and for the health units. So it was 99%, now it's confirmed.
Very good, very good. So what's the next steps then, Dr. Zayed?
Probably doesn't hear.
Who doesn't?
Helen Claire?
Helen Claire?
Yes. Thank you. I'm sorry, I didn't hear any of that. The
Okay.
audio went out again for me. I'm wondering, could you please repeat?
Sure. I want to, can you hear me now? Yeah. So I just want to confirm that I just received an email confirming that we are, Grey Bruce Health Unit is selected as a co-lead with Public Health Ontario to lead the work on community partnership and leverage the community work on the opioid crisis and overdose. So I said it was 99%, but now it's 100% confirmed.
Well done, well done. So I would assume a media release will go out with us. So, yeah.
7 house unit, and for us there was 5 house unit, now 7, in addition to us as a co-lead.
Just ignore that. Okay. Helen Claire, did you hear the comment that Dr. Zayed just made?
In and out. I guess
Okay.
I'll read it in the press release. It sounds like good news and what we wanted, especially in terms of the hard work that's being done in this community by a number of diverse groups. And I think it's going to be excellent that we're involved in this way.
All right, very good. So one other item, and that is to adjourn the meeting at 10:59. I need a mover and seconder, Brian Millen and Brian O'Leary, all in favor. That is carried. Thank you very much. Enjoy the weekend.
Thank you all. Take care.
Thank you, everybody. Bye for now.
Thank you so much. Thank you, Mary. Thank you. Good meeting.